It's the most frightening surge the nation has seen, and it's happening right here. Cases of coronavirus in New South Wales are soaring, reaching 818. Our death toll has risen again. A passenger from the doomed cruise ship Ruby Princess dying overnight. 7 of the nation's 8 deaths are in our state.
Last Thursday, when the Ruby Princess docked in Sydney, a female passenger in her 70s was taken directly to hospital. This morning, she died from COVID-19.
We are seeing an incredible burden in our recently returned overseas travellers, and it is essential to protect the border community and those that you love to maintain that self-isolation.
Cruise ships have been derided as floating incubators for corona, and for good reason. The Ruby Princess had 107 cases. 13 cases were linked to the Ovation of the Seas, which docked in Sydney on March 18. 7 cases were on board the Voyager of the Seas, which also docked the same day.
I say to the Premier, do not let one person off that ship until you are absolutely sure that they are safe to be in the community.
Another death on top of the state's worst spike in cases since the crisis began.
New South Wales is at a critical stage in relation to the virus. We need to make sure the spread stops. We need to make sure everybody who's in self-isolation stays in self-isolation.
149 cases in 24 hours. That's a total of 818 for New South Wales. 174 were locally acquired, 425 acquired overseas. 219 cases are untraceable. The dramatic increase in cases means New South Wales is edging towards a more extreme lockdown, like the one adopted in the UK. No gatherings of more than 2 people, only leaving home for the basic necessities, or going to work, but only if it's essential.
If we don't control the spread, we are looking at those options.
And from Health Minister Greg Hunt, a tighter lockdown is on the cards.
Right as we speak, those next stages are being designed, and the timing and the implementation measures for it are being carefully considered.
The feared hockey stick curve is happening. 3 weeks ago, New South Wales had 15 cases. It's now surged past 800. Dr Dan Swan is a clinical immunologist with the Garvan Institute. He says people should be locking themselves down now and not waiting for a government directive.
We're asking people to stay home in order to prevent a massive surge of sick patients, to give our hospitals time and space to look after critically sick people.
Increasing cases, frontline medical staff worried about how they will cope. And now the government threatening fines and arrest for anyone required to self-isolate.
We have compliance orders in New South Wales, and they will be pushed to the highest level, whether it's through police.
13 people are now in intensive care in the state. Dr Swarm says unless effective action is taken to flatten that upward trend in cases, we could run out of intensive care beds within 2 weeks. The message of social distancing seemingly lost on the crew of the Celebrity Solstice off the coast of Sydney this afternoon. 14 days ago, a passenger was offloaded in New Zealand with the virus. Mark Burrows, 9 News.
Let's go straight to our political editor, Chris Uhlmann in Canberra. Chris, what can we expect from the National Cabinet meeting tonight?
More restrictions on life as we know it, Pete. Remember, just 2 nights ago, the National Cabinet decided to shut down the entire hospitality, exercise and entertainment industries, and they call that Stage 1. Well, they're writing Stage 2 tonight, deciding what essential services are and trying to work out how to deal with cruise ships. And if the pace of the disease isn't slowed, then soon enough, the order will come to lock down entire cities. The Prime Minister will speak when the meeting is done, so stay tuned to 9, maybe about 9 o'clock tonight, and we'll bring it to you as soon as it happens, Pete.
I will see you then. Thank you, Chris. A matter of days, that's how long the coronavirus could linger on everyday surfaces. But the simple task of washing your hands may be the answer to stopping the spread.
From the Bowser to the basket, we're now in a situation where every surface has become a potential site of danger.
It does obviously spread, and it spreads widely in the community.
So widely that whether a counter or cloth looks clean or dirty, it could be contaminated. If an infected person coughs, coronavirus can travel around 2 metres. And if a droplet lands on a surface, a person who touches that surface can become ill.
There's no doubt it can survive for days on surfaces, and hence why hand hygiene, hand washing, alcohol hand rubs and cleaning surfaces appropriately all should make a difference for how often people pick this virus up.
Studies have shown coronavirus can live for 3 days on metal, glass and plastic, changing the way we fill up, fork out and cross the road.
My other masks now have been told is not, they only last a few hours.
I'm the only one who is shopping for my entire family. We have run out of sanitizers and liquid soaps.
Supermarkets across the country now scrambling to stop the scourge. Here at Harris Farm, it's a sophisticated setup of hand sanitizer, soap, paper towels and also disinfectant wipes. Each shopper is encouraged to do the right thing before they enter the store. The virus destroyed relatively easily, though, through these methods. But don't be hoodwinked into thinking latex gloves are the answer. Droplets can still survive on the surface.
What we need to do is presume our hands are ways we get this infection, probably much more than breathing it in or people coughing on us.
Airlie Walsh, 9 News.